For the National Registry medical assessment, the first step is going to be size up. So before I enter with the patient there, I'll put on appropriate PPE. I'll take a size up of the scene, so see how many patients are there and what's required, kind of just assessing the risk of the situation. The next step is going to be the primary survey. So I'm going to talk to the patient, and this is kind of just to see if they're conscious and how available is their conscience in a sense. You can also be looking at the airways and the heart and make sure that circulation is still occurring, so possibly shaking their hand and checking for the radial pulse. And then if you have a stethoscope on hand, you can also check the breathing and the pulse and listen to their heart and lungs. You want to ask them the chief complaint and their chief illness and what's going on. And then if anything like air is required, that'll occur. So after a priority assessment has been done, you'll be taking the history and a secondary assessment of the patient. So not only is it the history of this current illness, but a past medical history if they have any unrelated illness. So asking when the onset of this current illness has occurred, and just seeing if how long it's been going on and what made them call us. And then next you can also ask them about their previous medical history and see if it has anything to do with the current state of the patient. After addressing some of the history concerns, you will also be taking a secondary assessment, and that would be concerning vital signs and making sure the patient is okay, coming up with possible treatment plans, or a decision to take them to a hospital if they need a greater source of care. But that's kind of where the decision making comes in, and you'll repeat their vital signs to you and kind of walk them through the process of what's going on and what's being shown with their data. And then the last step of this process is reassessment, and so you're going to repeat the primary survey, you're going to repeat their vital signs, you're going to reevaluate and tell it to them how their vitals are doing, and then you're going to see if the treatment has improved the illness at hand or if any other things are needed at this moment. But that's an overall summary of the reassessment.